I said to Captain Carlos years ago that they should put the lobster on a shirt.
Yep. Charlene said yes.
Oh my fucking word! Thank Christ.
And the tagline was, "I got some tail at."
Oh, that's funny.
You know, I got voted down though.
Yep, I got a notification. Watch live on YouTube.
Wow.
Okay, we're on.
I can't believe it. That only took
On Facebook.
All right. So what is it on YouTube?
It's just go to the face. Go to my. It's on my Facebook. Would be the best place to see it.
I do love that new logo for the Captain Carlos though. That actually is a great.
What is your Facebook?
Or you could go to good. It's facebook.com/JoeyGMG.
Joey Dash.
No, Joey GMG. All one.
Joey GMG.
All right, I'm gonna close this. And all right, we're here. We're live. We did it. All right, can Chris, can you tell Charlene or someone needs to man the comments because I don't have the comments here. Oh, maybe
Charlene,
I could.
Charlene, Mia's gonna man the comments. She's sitting to my right.
Yeah, I can help you out with it too, whatever works.
Oh, that'd be great. Yeah, that'd be awesome. Thank you, Scottie. I appreciate it.
You're welcome.
All right,
Mia wants the responsibility.
It's Gloucestercast 402. We have Chris McCarthy, we have Scottie Mack, and we have a podcast virgin. Celena with a C.
Podcast 402. I think you got it all wrong, Joe. It's 420 today.
Well, it is 420 day.
420.
Yeah, it is 420 day. But we're going to introduce Celena. Celena is an ER nurse at Salem Hospital.
No.
ICU.
ICU.
ICU. Intensive care unit.
Yes.
I'm going back to the tape, Chris, on what you told me earlier.
All right.
You too, Joe.
And at Salem Hospital. So you're on the front lines. You're one of these people that we need to thank every day for putting yourself in risk. And we do, but as a podcast virgin, we need to ask you two questions. And everybody gets these questions when they're virgins on the Gloucestercast. You're on death row, and the guy that's about to execute you says your last. You can have a sub anywhere. We'll go any restaurant to get the sub. What sub would you like us to get from where, and what would that be for you?
Well, being a Gloucester newbie, I'm sure there's a better place here to get it, but Legal Seafoods does a good lobster roll.
Okay, good. That's good. That's solid. Because I thought you were going to say, we had James Eves. I did that with James Eves, and he said Subway, and he lives locally.
Oh, good God.
I knew better. I knew better than to say that.
I was like, James, are you serious right now? Okay, so
Was
and
he
now,
visiting Jared in prison?
right? So next question is death row meal. What restaurant and what meal?
Like
it doesn't have to be Gloucester. It could be anywhere.
Anywhere in the world.
At a restaurant, yeah. And what would it be?
I think the best meal I ever had and wouldn't mind a repeat was in Hawaii. And they came over and they made the Caesar salad, and they came over and they made the white chocolate mousse, and everything was just unbelievable.
Do you know what the name of that place was?
No.
Okay.
Of course not. It was on Oahu though, and we had to go downstairs to get into it.
Oh, there you go.
I'm sure that there's probably 50 restaurants that would, be.
So not only is today President's Day, one of the which generally is one of the best days of the year because it's Marathon Monday. Everybody gets it off. Well, not everybody, but
there's a Sox game.
Usually there's
that's right.
3 different
There's
sporting
baseball.
events. There's baseball and usually the Bruins and the Celtics are in the playoffs. You potentially could go to 1 or 2 games in the same day. And the marathon to me was always one of the best days of the year. Top 5 days of the year. Top 10 days of the year, because four days of fiestas at the top, Then you have
The anniversary's not in there, Joe, is one of the top.
no. I'm talking about public events.
Oh,
3rd of July, Thanksgiving Eve, Marathon Monday. Those are big ones. But not only is it all that, but it also lands on 420 Day. Scottie Mac is going to explain what 420 Day is.
I'm at a loss. I just know that you said it was podcast 402, and I heard it was 420. Chris McCarthy, you want to field this one on the field?
Yeah.
420 Day, I was told before we got on this podcast that it was Weed Day.
420 for stoners is the time when they universally light up during the day. At 4:20 in the afternoon, you light up.
Every 420 on April 20th.
Well, anything that has 420 in it, they like to use another excuse.
Any day.
Yeah.
There used to be a local union with Derek Arnold with the witch doctor, which was he had a T-shirt line called the Local 420 Union, and then he had got away from that tagline and opened up his business in Salem, which is the witch doctor with the RX symbol.
Ah, there you go.
The other thing is today is President's Day according to Scottie Mac.
President's Day. It's Patriots Day, but it's. I had them confused for a moment, and I said we got to give homage to pay patronage to George Washington, rather, that was growing his own hemp way back in the day, and then Chris reminded me that it was not President's Day; it was Patriots Day, and I said, well, George Washington was a patriot.
We're so full of misinformation today. It's fucking ridiculous.
Yeah. And in the spirit of true transparency, it's my daughter who reminded me it was not President's Day, but Patriots Day.
That's incredible.
If we're going to do a shout out to Lincoln, we should do a shout out to Bill Clinton because he was the only president.
He did not inhale.
Not to inhale.
Yeah, he did not inhale.
He did not inhale.
We have Mike Coder with us. Jimmy Dalpiaz is with us. Jimmy Dalpiaz says he is partaking in the 420 Club today.
Oh.
So
Emma Faulkner's with us, and so is your wife. Your wife's watching, Joe.
Oh, Kate's with us. Ed College with us. And Ralph DeGiorgio and 10 other people. So we got that.
Claire Hadley and a bunch of people, yes.
We had some issues getting going today. I think there was a Zoom update. So let's get right to Celena. And what I'm most interested in talking to you about is misconceptions that you would be able to dispel for us, because there is so much information coming at people, especially with social media, and what I'm guessing are misconceptions that are being repeated as if they are facts. You are on the front lines, and I'd like you to speak to what are, say, the top things that you hear repeatedly in social media that are absolutely wrong. And after that, we'll go on to some other topics.
Or true.
Or true. Yeah.
Okay.
Celena, before you jump in.
Yeah.
Before you jump in, I know there's a bunch of people joining now. For those of you who are just chiming in, Celena is an ICU nurse at Salem Hospital, North Shore Medical Center. So, Celena, thank you again for all that you do and all of your colleagues do.
Yes, thank you very much.
Absolutely.
Well, thank you. Well, we've all been working very hard during this. So just a little bit of background quickly. Our ICU at Salem Hospital can hold 20 people at normal operating, 20 people. And that's our max. That's where we cap. That's it. And at any time, if we do have 20 patients, maybe 10 to 15 are on the ventilator. Now we have 3 ICU units. So we have 1 unit that is just for normal ICU patients, and then we have 2 that are operating as a COVID ICU, and every patient is intubated. So
Can you explain
right
what
now,
can you explain what intubated means?
On the breathing machine.
Okay.
The machine is breathing for you, so you're also sedated. So they're not awake. They're basically in a medically induced coma, and the machine is breathing for them, and we're doing everything for them. They're getting tube feeds, they're getting their medication via a tube, they're on multiple other medications to help support their body, because most of these patients can't even maintain a blood pressure. So they can be on 1 or 2, maybe 4 to 5 different medications so that they can have a blood pressure. So they are incredibly ill. And since our ICU normally houses max of 20 patients, that's the staffing that we have. We are staffed. We have enough trained nurses to staff for 20 patients. Well, now we are staffing for 36 to 40
Wow.
intensive care patients.
Wow.
So that means that we've had to bring in travelers, which have, varying degrees of education or training, I should say. And they've also started, there's a pandemic model. And the way that works is you have an ICU nurse with helpers, which are like medical surgical nurses from other units that come in. And so it's like the ICU nurse, and then 1 to 2 med surg nurses and 4 patients. So that's essentially where we are right now.
Is that the same staff that's rotating through your other beyond the 20 ICU that you're prepared for? That's the same staff that's also going to the additional ICU?
Yes. Yeah, we'll all be in different units. Like this week I happened to be in the actual ICU, but last week I was downstairs in one of the new ICUs. But also being in one of those ICUs poses its own problems because it's not set up for an ICU. So you have all of those problems, and Salem Hospital actually has the most COVID cases for a community hospital in the state. We have, at last count, which was, I think I worked yesterday, we had 110 patients in the hospital with COVID. So, and the reason it's only 110 is because we are partners, we are able to send overflow. Like I said, we will only take max of 39 patients in the ICU. If it's an ICU patient, it goes into Boston because we don't have staff for it, and they can have 150 ICU patients in town at Mass General. So that's where we've been sending them. So my thought, one of the biggest misconceptions is that it's getting better. It's not yet. Like yesterday when I left, there were 4 patients that were intubated that needed some place to go. So from the floors or from the emergency department. So, and we only had 2 beds available. So they got to go somewhere. Yeah. So they went into town. And what's scary with this particular virus, so it causes a pneumonia, and these patients will be fine. They're intubated, or they're normal. They're on the regular floor. They're breathing. They're maybe on a couple of liters of oxygen, in their nose that you usually see on the TV shows. They're speaking, they're talking, they're eating, they're fine. But all of a sudden, they'll be talking to you, and then they just crash. Wow. And their oxygen requirements skyrocket, and they're intubated within an hour. So they go from seemingly fine to really sick, and it happens incredibly fast. And it's happening to young people. That is another misconception. People keep saying, oh, I'm healthy, or it's just the old people. It's not. We have patients ranging from age from 25 all the way up to 94, which is not so young. But I mean, these are young people that have been there for weeks, since it started. And they're supposed to be young. So you think, well, they're healthy. Right. And they were. But so I would say that's a big misconception.
I have a question.
Absolutely.
We were talking the other day, and I was just curious, the patients that you're seeing, they may not have an underlying condition, but do you notice any correlation to like smokers versus non-smokers? Is that a question that you ask?
That was the tip of my tongue.
Yeah. You know, a lot the people that are requiring more support from the breathing machine or needing it longer are definitely have lung issues, either past smokers, current smokers, but some of the young kids, and I haven't been able to get an answer to this yet. I'm wondering if they were vaping because, you know,
The popcorn lung.
exactly. And, you know, some of it it almost opens. So you have all these little sacs, almost like grapes. Think of them like grapes.
Nodes or whatever.
Yeah. So those are called alveoli, and that's where the gas exchange happens. So with vaping, it can take them from these small little things and make them kind of bigger. So part of the problem with this COVID is you get this like sludge that hangs out in these alveoli and just doesn't come out. So if it's this big block of it, I'm wondering if that's what's making it worse for younger people. You know, it's just I haven't gotten a good answer to that one yet, though.
Another question.
After Chris's question, I have a question. No,
Sorry.
that's okay, Chris. If you get a follow-up, please.
No, well, it's a different question because what really is heartbreaking is the fact that, you know, family members can't be with these folks. So again, you hear that on the TV. Is that something that, I mean, if someone wants to see a loved one, they can't. No ifs, ands, or
They
buts.
can't.
Really?
What we are doing now, and also like, you know, everybody's got a phone these days, so they're video chatting either, you know, Facebook or however they're doing it, but they're video chatting. So they're seeing, not that it's the same, we all know, they're seeing their family, and then they're fine and they're kind of, you know, laughing and joking, and then they're not. And that's the last that these people are seeing of their family member, is with this terror on
Are
their
you prepared
face.
to alert them during that time, though, if they take a turn for the worse?
We do.
Okay.
We do alert them, because also, you know, if the person's older, we want to say, do you really want to continue with this? Because unfortunately, ventilators are a resource that's in short supply, and we only have so many. And since I believe the 1970s, they've come up with a scoring system for who gets the ventilators and who does not.
Like a triage type of deal.
Exactly. So patients could potentially be taken off of the ventilator if they're deemed unworthy, or, you know, their score is too high and we don't have enough. Luckily, we're not there, thankfully, but it is, you know, a concern. At any rate, and so now we have iPads actually at work, so that we can call the families and they can see their family member, although most of them opt not to do it right now since they're intubated and sedated. They can't really interact. If we think a patient is going to imminently die, we do call the family and we do our best to make arrangements so that they can get in to see their family member before they pass.
Celena.
And of course, in order to do that, they have to wear all the same protective equipment that we're wearing.
Is your hospital using that medication that we've heard President Trump mention multiple times during his
the hydro
his
something
daily briefings? Yeah.
I'm not gonna lie, I try not to listen to anything he has to say, so I'm not certain what medication you're talking about. But I know we are using a couple of anti-malarial drugs that have shown some promise. So we are using those. I know he talked about using one of them in conjunction with azithromycin, which can cause a fatal heart rhythm. So we don't do that. But we have been giving the anti-malarial, and some of our patients have qualified for a clinical trial. So we send them into Boston so that they can get on that clinical trial.
So Celena, my question for you was, and this is more on a personal level for me, and I know you're not a doctor, so I'm not asking you for any sort of medical attention or advice.
Oh, geez.
have you seen? I have severe sleep apnea.
Mhm.
No, I'm being serious here. I snore. I have trophies. I mean, it's embarrassing and it really does suck. But I'm putting myself out there so that hopefully somebody in the same position that I am. How much more at risk am I with my severe sleep apnea with breathing, where I stop breathing so many times during the evening? If I contracted COVID, or have you seen these cases with somebody that's in my position at your hospital in the ICU? And what can you speak on that a bit?
I have not, but I will say, do you use your CPAP at night?
Yes,
Okay. So I
occasionally,
think
not all the time.
I think it would help to use it.
Scottie, I'm a doctor. You should use it every night.
I agree with you. And guess what? It's just, I actually
You could throw the sexy time out the fucking window if you're gonna wear one of those CP3O masks on your face.
That is
yes,
true.
yes.
That
No,
is
no,
true.
no.
They
Not
don't
gonna
look
happen.
comfortable.
It's true, but truth be told, I was in the process of. I went through the testing. I did the sleep studies. I knew already. I've had 3 other sleep studies done. I was in the process of going for the surgery, and then they canceled due to the COVID for anything elective or that you not necessarily as an emergency type of situation.
Right.
Canceled all surgeries, and I haven't been able to follow through with that yet. And that made me really concerned because I do have a lot of trouble breathing, especially during allergy season today, where it's very, very severe this week.
Mhm.
I watched the allergy report in the morning. I'm on medication for it, but with the and not just for me specifically, I'm talking in general for people in my situation or also that do experience what I'm experiencing. You haven't seen that, but I'm very, very much worried about if I come in contact with it at my age, because you're seeing a lot of older people, now you're seeing younger people.
Yeah.
That very
You got
well
a lot
could
of
be a high
40-year-olds.
risk precondition. Yes.
Yeah, I would think. So my thought is part of the issue with COVID is gas exchange. Your lungs aren't working as effectively as possible because there's not as much surface area for the exchange to happen. So sleep apnea, you're not getting enough air into your lungs. So you are doubling up on the impairment of your gas exchange, is my thought. So wear your CPAP at night.
Point taken. Okay, that was my question. Thank you.
Jesus Christ, it's so scary.
It is.
It
I'm
truly
horrified. I'm
is.
completely horrified right now.
Celena, another question that confuses me, and I don't know the exact numbers, but there's a certain number of Americans who have been tested. So my understanding is to get tested, you have to, have, the fever or cough, or you got to meet some sort of criteria in order to
Correct.
get permission to be tested. So you
Yep.
get that number versus the actual number of people who've tested positive. The delta between those who have been tested positive and those who have been tested, what the hell do they have? Because obviously they had enough symptoms like fever, cough
Mhm.
to get tested. So do they just have the normal flu? Is it in their head? Help me
Well,
understand the
it's
difference.
different things. I mean, part of it is, maybe they are crazy, or they, we all are hypochondriacs.
Well, anxiety levels right now are through the roof
Exactly.
to begin with, and the tightness of your
Mhm.
chest, that can be a symptom of anxiety, and
Mhm.
really with the pollen count 11 for the last couple of days.
Yeah.
People have raspy throats right now, and they're thinking, I can't imagine the number of people, like the phone calls, like
Yes.
whoever has to field those phone calls, it must be.
Joey, the pollen count, and I said it before in a couple podcasts back, and I'll say it again. with the pollen count and having allergies as bad as I do or anybody does, they know that they get that scratchy throat like you just mentioned, and they do look at you like you're a complete asshole for coughing.
Well, not just
They do.
Yeah, but not just, but yourself. Don't you have anxiety yourself? Like thinking, like,
do,
oh,
I
do
do.
I have it?
Other
Like, what?
Well, it all ties in. Everybody's fearful right now on
Yeah.
many different levels.
Yeah.
So,
Well,
Selena-
and so also, speaking to Chris's question, so the coronavirus is that we are experiencing is actually a member. The COVID-19 is a member of the coronavirus family. Most of our seasonal colds are from the coronavirus, but it's usually just doesn't affect us nearly as badly. But some of them can be severe, like SARS and MERS are also part of the corona family. So they could have some other corona virus that's just not this or the coronavirus or, COVID-19, whatever you want to call it. We do have a couple of patients in the hospital that have tested negative multiple times, but everything else is screaming COVID. And it's like, well, what do they have then?
So
I
you
mean,
think there's a lot of room for margin of error in diagnosing the 19 when there's a lot of coronavirus out there? Do you think that the numbers are inflated because they don't know it's actually 19, or vice versa?
I don't think there's false positives. I think that sometimes, and they're also, like the test results either will come back within 24 hours or it can take a couple of days. And it kind of depends on how badly or how much the virus is in there. And that's why we test every negative. That's an inpatient gets tested twice. So if you were negative, we test you again 24 hours later.
So
to
that
see if that
actually
one is
adds to
positive.
the number of tests needed then. When they say we don't have enough tests, you're actually using double and triple the tests sometimes.
Is there
Yep.
has there been any relief on the number of tests being made available?
I have no idea.
Okay. I'm wondering, like, it's for people to get on with their lives when it's the right time. I'm wondering if everybody's going to be able to get the damn test to know if they've had it. If you get it so say you get it and you didn't realize you had it, and whatever you're past whatever thing, and you get tested, but you have no symptoms. How does that work? As far as are you at that point you're not able to transmit it?
So, like, are you saying like I had it, I was maybe sick, or maybe I was asymptomatic and got tested later?
Yeah.
It would be negative.
Negative meaning what? I'm sorry.
Meaning you don't have it.
You don't have it. Okay, so you wouldn't know that you had it if you never got tested and you tested negative. You would never know.
Correct.
Okay, I got you.
Selena, have you seen any patients twice? Because we're hearing in South Korea, there's a certain number of patients now who have caught COVID-19 twice. Are you aware of any in Salem?
Not yet. We've just barely started discharging people.
Really?
And we've only had a couple leave from the ICU. But I think 150 people with COVID have been discharged from our hospital. And we've actually started playing a song over the PA system.
I Will Survive or something?
Is that anything to keep the spirits up for everybody?
It is. So normally they play a song for a baby being born. So now they're starting to play a song right now.
Baby Shark?
Well, for the babies?
Yes.
They play Brahms' Lullaby. So now they're playing some Vivaldi song. But we're voting on what song we want it to be for when somebody either gets extubated or gets discharged to play.
I would say, I Will Survive.
That's in the running.
Selena, I have another question. I'm filled with questions tonight.
You are.
We're hearing on the news that aside from those who are coming down with COVID-19, that for those of us who are hunkered down in the house, causing anxiety, causing domestic abuse, alcoholism. Are you seeing any signs of this getting to healthy people? Not the COVID-19, but some of the issues that come along with us being stuck in the house for the past month and a half.
I've not seen it in the hospital. Strangely enough, it's like all other illness has taken a holiday. We really don't get as many heart attacks. I've seen 0 flu. I mean, it's amazing. And, like things that we normally got, we used to have, 5, 6 GI bleeds. I don't know what's happening. It's not happening.
Is that concerning that maybe people are afraid to come in?
I think they are. I think,
Yeah.
Well, and, people have said, for all the things that people go to the emergency department for, like 90% of it is a waste of time. You could have done it at your doctor's office. And I think people maybe are actually just waiting to go to their doctor.
How about food allergy people? Because I mean, they say that the food that's left on the shelves at the supermarkets is all the gluten-free foods that are actually left on the shelves. So are we having any food allergy rushes in for people not getting their gluten-free food?
Not that I've seen.
Okay.
But
Just trying to bring some
might
light
be,
to this conversation today.
I'll ask my coworkers that are gluten-free. I'll ask them how they're managing.
All of a sudden, now the gluten-free is the stuff that's left on the shelf, and they're just buying up everything else.
Well, that.
And I'm not knocking that because somebody that has that serious food allergy, but it was something that was brought up to me, so I'm bringing it to the general public.
That's a very good question. I honestly don't know.
Thank you. You want to say hello, Joey, to the people chiming in?
Yeah, go ahead. Give it to them.
All right. Well, we have Jim Del Piaz, as always, Annie Rashawn, John Orlando. A fan favorite here by a lot of people by far is Joey Foote.
Hey, Joey.
Jim Smith. Jim Smith has been watching for a while. Paula Ryan O'Brien. Peter Scola. Marianne Giabunco and John Orlando and Minnie Pollard. Hi, Minnie. How are you? Pam Gallagher, Mike Coder, and Kristen, and so on down the line. We just want to give a shout to people that have been watching for a while. So thank you guys for tuning in.
Yeah, we appreciate those people for sure.
I know Jim Dalpiaz asked a question, 2 questions, Celena. He's interested in just understanding your shift, how they're giving you guys some time off to take a breather. And then secondly, maybe this is at some point when we conclude this discussion, is how do we fix this damn thing from your perspective? Where do we go from here? Because a big question everybody asks themselves when they wake up is, when is this going to end?
How does it unwind? How do you see it unwinding? That's how I would ask the question.
Right. Okay. So like how my day goes, like what I do?
Like your schedule, are you like 4 days?
I do 7 a.m. to 7 p.m. I work 3 days a week. So right now I'm doing a lot of like 2 days on and then like 3 days off and 2 days on, 3 days off.
Has the union tried to implement any extra hours for you? I mean, it is a union job, correct?
It is.
Okay, so are they able to, is it up to you as the worker to take more hours, or can they force you to work more hours?
No, it's up to me.
In an emergency situation.
So many years, I think maybe 10 years ago, they made mandatory overtime illegal. But of course, sometimes it happens. So the hospital would have to pay a fine. So they work really, really hard to not have to do that.
If you wanted to volunteer, could you volunteer?
Oh, absolutely.
Days off?
Yes.
Or you could sign up for overtime shifts that were available.
Yes.
Okay.
The only thing is I'm not allowed, and nobody is allowed to work more than 16 hours.
Oh, wow.
So that's the max. I mean, you can end up staying late to finish things, because we oftentimes are so busy, we don't do any charting. And like normally in my shift, I would have to do a full, complete assessment every 4 hours. And every 2 hours, do a neuro assessment. And every hour, I'm putting in like their vital signs. All that documentation takes a lot of time. So now this shows how busy we are. We now have to document once a shift.
Yeah.
So it's a huge, like, it's such a different, it's a mind.
Celena, one quick question for you on safety and PPE. So is there a station set up for the nurses and doctors and staffing when they come in, sort of like a cleansing station as you come in the building before you hit the main floors? Yeah, exactly. And then also again when you leave, is there something set up, protocol for you?
So when I get to work each day, I have to have my phone out and show them that I passed my COVID test for the day, which consists of, do you have any of these symptoms? And then I must Purell my hands. I get my mask for the day, one mask for the entire day, and a little cute brown paper bag to put my mask in for the times I'm not wearing it, if I'm eating. And then when I get to my unit, I get my special mask for the COVID rooms because you have to use a special mask, and my hair bonnet, and I get my face shield. Now, the face shields were pretty hard to come by, but a company actually donated a huge box of like reusable ones.
Wow.
So luckily now I don't have to look for face shields anymore. So that's a big time saver. And then they stock the gowns outside of each room. So I do know that some facilities have to reuse their gowns, their protective gowns when they go in and out of the rooms. But we're not there. We're still disposing them after every patient, as you should. But you get the one regular mask to wear at all times, and then the one mask for the COVID patients for the entire day. And we're recycling them because they have that place in Somerville now where they decontaminate them and send them back. But all of us are like, I'm not wearing that. I don't know how safe it is. I mean, is it going to still provide the proper seal? What chemicals are they using to decontaminate these that I'm going to be breathing in for 12 hours at a time? What's my health risk with those chemicals?
Especially you seeing the patients, what they're going through.
Exactly.
It's like, some people may, the people that you see on the street that say, it's just the flu. Like they don't get, so.
Yeah, but even like
you really, after seeing what these patients are going through, don't want to get it. Yeah.
Right. I mean, and even the flu can really knock people for a loop, and they can be on the ventilator for the flu.
Yeah.
So yeah, I guess, if you really want to say it's like a bad flu, it's like the mother of all flus.
I appreciate you taking us for a walkthrough on that because I was curious myself, as I'm sure many of the viewers are, and Joey, I'm sure you and Chris as well. Yeah. I mean,
and I also I forgot to say, we do change at work, change into scrubs provided by work, and then so when we leave, we change, and showers are available if you want them. But I just change into clothes. I come home and I go directly to the shower.
Oh.
In my mind, I just picture this like almost like a car wash station where it mists you with Purell.
I almost would like that. I wouldn't say no to that.
Yeah. So it's interesting that they have the Purell and okay, demystify this for me.
Okay.
Will dispel this rumor or confirm this rumor. That soap is better than Purell. Washing your hands with soap is better than Purell.
I think with this particular virus, Purell is fine.
Purell is fine. Okay. And the other thing is, I've heard conflicting reports that if you're walking outdoors, that the chance of getting it outdoors, like passing by someone, is very, 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 very slim. Is that correct or not? Even if you don't have a mask.
Even if you don't have a mask, I honestly, I haven't seen anything, but you're outside. It's, like the wind's blowing. I would think that it's very minimal.
Yeah. Well, that's. I mean, I've heard.
Question.
What's that, Chris?
That's the question I have is like, if you are behind someone who, say, has a small sneeze or a cough or a jogger, they run by you and they're breathing hard. The corona or the COVID-19, does it only take one little of those ugly looking things they see on TV with the things coming out of it, or does it take multiple little COVID
Droplets. They
buds?
call them droplets, I think.
But it can land on your body and you would be. And correct me if I'm wrong. Again, it can land on your body and you would be fine. It has to get to your eyes, mouth, or
nose.
Right?
But if it lands on your body and you touch that part of your
and then
body
touch
and
it,
then you touch your face,
right.
there you
Now,
go.
this was another concern of people, and being 420, smoke. Can it be transmitted through smoke, like cigarette smoke, marijuana smoke? Because that's in your body, it's in your lungs, and you're breathing that out. And I heard on Howard Stern, Dr. Agus. You're laughing.
I haven't heard Howard Stern in years.
Howard Stern is a germaphobe. So I listened to Dr. Agus on Howard Stern, and he said that some scientific evidence is projected up to 37 feet that it can actually travel. They did some testing. Now, with cigarette smoke, when you're breathing that in and you're breathing it out, and anybody that knows that comes within 15 to 20 feet of a cigarette can smell that, or if the car length in front of you or two car lengths in front of you, you can smell the marijuana. Now, is that something that's transmittable through cigarette smoke or marijuana smoke?
I don't know. I do know that when somebody does like a nebulizer treatment, it does aerosolize the virus, which makes it travel much further.
Okay, so
I wonder
scary.
maybe if the
scary.
smoke does that.
It's very
scary. So now we don't do nebulizers in the hospital right now because you can't reuse your mask, and it makes everybody more susceptible to get the virus. And also to add to the fear factor, if you will, because people don't believe it's as scary as it is. So normally when code somebody, meaning that their heart has stopped, they've stopped breathing, we do chest compressions, and we do, even if they're intubated, they come off of the breathing machine and we do the bag, like you see on TV. They have that blue bag and they breathe for the patient, right? They're doing this. We don't do that. You don't get to be bagged because it is dangerous to the staff. So if you're sick in the hospital and you're on multiple blood pressure medications to maintain a blood pressure, it's safe to say your heart might stop, which means that we cannot do effective CPR on you, which means that you're probably going to die.
Oh my God.
Wow.
So this is why it's important to continue with the social distancing. I mean, yes, I understand the economy sucks. It's bad, but you know what? It's better than burying your family members.
You, in your personal opinion, on the downslope of things right now, they keep talking about this 14-day decline. Have you seen any decline at this point, or is it just continuing to rise? And do you think that opening up certain like beaches and things like that have been closed, I'm not saying most of them in Gloucester, but I'm talking statewide, is it too soon, in your opinion?
I think it is. I do. I mean, first of all, I haven't seen a decline. We just keep filling up. I mean, each time I go into work, there's more and more patients that are in the hospital with it.
Yeah, there hasn't. She said that she hasn't seen this hasn't peaked yet, or haven't it hasn't gone down yet in her
Right.
from her perspective at her hospital.
Exactly.
Yeah.
Well, Massachusetts
So,
fine too.
and even though once it does start to decline, I don't think, you can't be like, oh, hey, it started declining on, Tuesday and it's now Friday. Let's
Yeah,
open
there's
things
gonna be
up.
no
You need
curtain
longer
call
than
here
that.
where the curtain goes up and says, everybody go back to the world. I mean, it's gonna be slowly.
But is it? I mean, are people
I
going
don't
to
know.
listen?
I mean, do you think one day, just like on one individual day, it's gonna say, all right, Corona's over and everybody go have fun? No, that's
Right.
not gonna happen.
We got a question from Joey Foot about asthma. Are you seeing patients with asthma at higher risk?
Well, they're at higher risk of a rapid decline
Okay. Yeah.
because their lungs are already compromised.
Yeah. And
So-
how about sorry, Joe, one other quick question.
Mhm.
When these patients come in, I'm assuming you ask them a series of questions. Is there a sense of how they're getting it? Where do they know that they were around somebody who had it, or was it like
Yeah.
a complete surprise?
No, a lot of them do have they had a sick contact, or you have other people who do have no idea. So, or I got a guy recently and he was like, well, my wife's actually at home and she's sicker than I am. And I was like, well, considering we're about to intubate you, I think we need to get her into the hospital. Like,
Mm.
But people refuse to come and you can't force people to come in.
Oh my God.
Do you have a message to young people and middle-aged people? So much the older people are not so much social media savvy. I mean, I'm not saying that they're not, but there's a big percentage that are not. So for people that are taking care of their parents or maybe young children, do you have a message for them right now?
I would say,
Any advice?
like, I have a 10-year-old daughter and she's, devastated not being able to play and interact with her friends, like in real life. And I know a lot of parents might give into that and be like, oh, well, so-and-so's family's been quarantined too, so I'm sure they're fine. And people will do these small get-togethers, like, well, we've all been quarantined, so everybody's safe. But you know what? If you have had takeout, if you have went to the grocery store, went to CVS, you have interacted with other people. You have potentially infected yourself. How would you live with yourself knowing that you infected somebody else's child, your own child, your parents?
Parent, yeah.
And even if they have, hopefully, even if they have a good outcome, like, do you want that to be on your conscience? Like, we just need to be there for our kids and be strong and not let them run the show.
Yeah, be a parent.
Be a parent.
Yeah.
It sucks. Everybody hates it. We're all tired of it. We don't want to be stuck in the house anymore. Zoom is great, but I want to have cocktails in real life. But it's better than going to the cemetery and having those cocktails. I'd
Joey,
rather wait a couple more weeks.
I want to flip the script for a second, if you don't mind here, Joey.
Go ahead.
We've been asking.
I just wanted to do one thing because I've been trying to. I haven't had a shit. I'd like to ask the people that are watching right now, because I think this is incredible what Celena, the information that she's sharing us from the front lines. I'm asking the people that are watching this right now, please, can you just hit the button that says share so you can share this video so more people can get this information. You could save a life. So please just take 2 seconds, hit the share button. I would really appreciate it. Scottie, go ahead. Sorry.
I thought it might be fun for a change. Whenever we have guests on, we're always asking them the questions. Why don't we flip the script, and Celena, as being a first timer, why don't we ask Celena if she has a question for any one of us?
Well, I wish I had known that ahead of time. I could have prepared something.
Except me.
Can I ask you anything? Have you have you gentlemen picked up any new hobbies in your time away from work?
Well, I've
or
done.
anything that can be shared.
Well, I haven't picked up new hobbies. I've reinforced the hobbies that I didn't have time for before. But what I have picked up is actually doing more stuff around the house that I neglected for a bazillion years, which is probably true for a lot of people.
I kind
That's
of
why there was a line at Home
Joe.
Depot.
I agree with Joe on that for myself personally. And then I've started doing some more yard stuff, and being a little bit more outdoors than glued to Netflix and in the entertainment scene. I'm completely shut down for business right now because nobody's booking parties for future stuff right now, and you can't get together and have gatherings. So it's a breath, no pun intended, a breath of fresh air to be outside doing some projects that I would never find myself doing otherwise.
Mm-hmm.
How about you, Chris?
So similar to you, Joe, I've always enjoyed cooking, but I've taken this time to branch out and try making stuff that I've never made before.
Is this like the chicken fingers that you made earlier?
Kind of like
I don't know about those.
Fingers. Yeah, kind of. Yeah, I don't know if they came out okay. Of course, some of these recipes it takes you a couple times to get it perfect. But I've enjoyed it. I think my family has enjoyed trying different stuff. I mean, tonight it really hit me how when you're staying at home, as long as 24/7, pretty much, unless you want to eat mac and cheese and toast and eggs. I mean, cooking is time consuming. It takes a lot of thought. You need all the right ingredients. I mean, if you want to have a good dinner and mix it up and not have the same stuff over and over.
Don't you find it rewarding though?
Yeah. Oh yeah.
Yeah. I mean, I've been enjoying like discovering new things like that. And it's the bread making thing. I don't know. I'm trying to figure out if it was the chicken or the egg. If like everybody was getting into bread thing there, and I just caught it. I read someone else's post and started, but like I'm obsessed with making, and it's so easy.
Yeah.
I mean, you made it. How did your bread turn out?
Oh, the only problem is the loaf disappeared in 45 minutes.
Yeah.
And I mean, it's just especially warm
with the butter.
It's just outstanding. It's like, why would you eat any other bread? Like, but at the same time, again, it's time consuming. You got to make it the night before.
But so here's the thing: like in this situation, when you have nothing but fucking time, why wouldn't you fill up that time with something creative that you hadn't done before? Like and like. There's that reward at the end, just like barbecue. It's the same thing, concept of cooking a 12-hour brisket.
You can take it for granted.
Your mind is off because you're making sure you're not fucking it up, and then at the end you get something delicious.
Right. Yeah. Well, I asked
Sean a message for.
Hey, Paul Gamble, how you doing? Aaron Tuffley, Patty Wall, Shivas Rock, Tommy Testaverde, Eddie Stewart, Brenda Grimes Davis, one of our regulars, Karen Pischke, Charlene, Lauren Pierce Cavuto, Carolyn Kukuru, Gaetano Brancleone, Robin Calenda, Julie Quinn Redmond, Ronnie Longoria, Joe Borland, Bruce Lane,
Joe B,
Mary Pilano, Keith Martell, and that was where the list stopped off before.
Shivas Rock wants to thank Celena for all of her hard work. So Shivas Rock says thank you.
She's one of my coworkers and one of our union leaders.
Oh, that's awesome. So she may be keeping an eye on you just in case. And she's going to send you personal text messages to make sure you don't screw up and get yourself in trouble.
16 hours.
No, she's on my side. She's on my side.
No, I know, but she's trying to keep you safe too, so she doesn't have to do any extra work. So Paul Gamber, who's a dentist, owns his own dentist. Paul, I'm curious from your perspective, because I know you're watching right now. If you had any questions for Celena, who is an ICU nurse at Salem Hospital. I got that right, Celena?
Yes.
Okay. So, Paul, if you had any questions from your dental perspective for Celena, Bender Grimes Davis also says thank you to Celena.
Yeah.
So yeah,
And that's to any of your viewers. Again,
Yeah.
if you have any questions, I mean, this is the time. You don't
So
get many chances to
so here
speak
was
to
my-
someone on the front line.
So here's my question. In the meantime, how do you see it unwinding though? So what? Like,
Oh, yeah.
you know, how do you see it unwinding? Like so this is the big question that I think about all the time. Is like, so say 2 months from now, you know, things decline and it's down to like 15% of what it is today. It's still out there, right? So how does a decision maker say it's time, let's go, you can walk outside now? How does it not ramp up from there? I don't understand how this unwinds. It's like the great mystery to me.
Well, I believe it has to do with it's partially weather. When the weather gets warmer and like hotter, because the virus is fragile when it's not inside the body, it will automatically kill it off. Also, the fewer sick people that are around, the fewer people that are shedding the virus onto surfaces where we might pick it up. So there will be fewer virus to be picked up from places. So I think it's just one of those like slow, it's going to be like a slow decline.
But if we're all social distancing right now, or 80% of us are social distancing now, and you take the reins off,
mhm.
doesn't that mushroom it? Even though there's less people that
I
have
think
it?
if we do it now,
Yeah.
if we do it now, because we're still at the top, I think we need to get much closer. Like we need, like I heard that the peak was supposed to be today.
Oh.
So I don't know if it's changed or not, but I had heard the peak was today. So
Yeah.
if the peak's today, I think we need to wait, make sure it's the peak, give it, a week or two, and then reassess the situation.
What is everybody's thoughts on the good weather yesterday, where all of a sudden, I mean, it looked like a Friday afternoon rush hour with the good weather out there, and just people out everywhere, and as they're supposed to be staying home. We get it that, stay at home, but they don't listen, and they go out and they drive around, and the streets were packed, the sidewalks, the boulevard, the trails, the everything else was packed. I get that we've been through a long winter. It's been a very mild winter, but then the corona on top of that. And then now they were talking, later in the season, later in the summer, we might miss this, and this is canceled till September, and X, Y, and Z. And then we're going to be right in the same boat to fall into fall and winter again with depression and everything else. Do you agree or disagree with the good weather and everybody being out yesterday?
I was going to ask you where you were going for a second there. I was like, is this a question about mental health or?
No, but I mean, all those things combined, and it comes back full circle. So,
No,
I mean, is it
it's great. I think people definitely do need to get outside, but you need to be smart about it. Don't go to a place where there's going to be a lot of people. Because again, that's not social distancing, and you need to be aware, if you're getting in your car, that means that you're using gas. So when you go to the gas station, you're exposing yourself. All of these little things, you're exposing yourself.
Mhm.
But also conversely, I mean, mental health is huge. If you stay in your house, you're going to lose your mind. So it is important to get outside. You just have to be safe and, use your Purell. Don't touch your face.
What's your protocol at the gas station? No, I'm curious what other people do. What's that?
I put on my face shield and my gloves. No, I'm kidding.
I was gonna say.
I get my gas and then I Purell and I get back in my car and I leave.
Oh, so you pump it yourself?
I do.
Okay.
With your gloves. Celena, I have a question from a family member who opted to text me.
Oh, wow.
She is telling me that her hairdresser indicated that they were going to be opening May 5th. and she wanted your opinion on whether or not she should go to get her hair done, even if she wears a face mask, and that her husband has an eye appointment in May 11th. Both are in the older category. Any advice for those two individuals that may have appointments coming up in early May?
I think as far as the doctor's appointment, definitely wear a mask. Doctor's appointments are important. If it can be delayed, delay it. Hair, as much as we all want to get to the salon, I think that's something that can be put off. But I mean, the mayor did say May 4th was the day to open. So maybe the 5th will be okay. I honestly, I don't.
Our mayor said that? Did our
I'm
mayor?
sorry, the governor.
Oh,
The governor.
Yeah, okay. I was
Yeah.
Or
wrong.
no, I don't know. Either the Boston mayor or the governor, one of
Okay.
the two of them,
Right.
had said May 4th.
I think that was I'm not, so, okay.
But that was a while ago.
Yeah, that was a while ago. And I think that they have these dates that, they're going to
They're very arbitrary.
They're going to revisit. Right. They're going to,
Exactly.
they can be,
Yeah.
chances are it's going to be revisited and maybe pushed forward if we're just hitting the peak now and we're not that far away.
We have another question. We have another question from Mia McCarthy.
I don't know her.
She wants to go back to school. What are your
No,
thoughts?
she doesn't.
What are your thoughts about schools opening May 5th?
I think that the schools shouldn't open yet. I think that they need to make sure this thing is under control. I mean, I don't know what's going to be going on May 1st, but that's only 10 days away.
Yeah.
Are we going to really have this thing under control by then?
Yeah. She's disappointed to hear that. She wants to go back.
Honestly, my concern is that we open things too early and we end up
in a worse
locked
situation
down for another 3-4 months.
I don't see.
It could have just been a couple weeks.
Right. I for that reason, I feel like every politician, knowing that they have, that it's a huge decision, is going to err on the side of caution. And I just don't see. It's just like with insurance companies, right? Like you always have to when you're running a business, you have to go to that factor of safety, because you don't want to. I don't know if you understand what I'm trying to say, but the politicians are not going to be the one want to let everything loose and people
have it come back to bite them in the ass.
And the numbers ramp up out of control, and it's going to be very clear because you have your baselines, whose fault that was, and they never want to be at fault. I mean, they have to make difficult decisions. So I'm not saying that they're doing right or wrong things. I'm just saying, in their minds, my guess is that they're going to err on the side of caution. And
but they also
probably rightfully so.
They may cave because of the public.
Because of business pressure, you mean?
Yes.
Or yeah.
Yeah, they're in a difficult spot. I mean, if I put myself in the shoes of many of these politicians, I don't know what I would do, because there's a right answer for both sides of the argument. It's just, I mean, they're in a really tough spot. Regardless of the decision they make, they're going to be
because especially with the way people are so polarizing in their political views. Regardless, it doesn't matter. You have that whole layer on top of it, where the second guessing is, you could pick out for either side, left or right. They can read the same story, and this side pick this thing of how it was such a victory, and the other side pick how it was such a fucking dumb thing to say.
What's the code word on politics, or we're not supposed to talk about?
Well, we didn't talk about a specific party. I
forgot. Was it Oprah or
Oprah?
pineapple?
Oprah is the word. Yeah, we use. when we feel like we're going outside.
I didn't know how else to say it, Joey. I forgot the code word, but I figured let's just.
Well, I didn't take a shot. It's like that's more or less if you're taking a side. We don't take.
I was
okay,
showing
okay,
empathy.
all right.
What's
I'm
that?
showing empathy. I was showing empathy towards any politician, regardless of what side they're on, because
I thought you were just trying to
No,
get.
I agree.
Well,
That's what I'm saying. Is the second guessing must be maddening. Like what I don't even want to get into that. So as someone that donates a lot of time to public service, right? Like, and you do and like a lot of our politicians are doing, and then to have people take pot shots at you when you're probably sitting in 12 to 14 hours of Zoom meetings a day, trying to figure out what the right thing is to do, trying to keep people safe, and then people take shots at you, must be fucking maddening. Maddening. I couldn't imagine. I just couldn't imagine.
I couldn't imagine either. I'm with you on that
Why
one.
we don't go into that?
No. Yeah.
Why I'm not running for office?
Hell no.
Well, and it's funny you say that, Celena, because I look at the mayor, the governor, the president, the mayor of Gloucester, the mayor of Boston, and no one could have predicted this. Their jobs are hard enough, and when something like this comes around, I mean, must be scratching their head at night, saying, "Holy shit! What did I do? What did I get myself into?"
Yeah.
It's again, my heart goes out to all of them, including.
I don't think that they could have ever imagined like that this was going to come their way and how to handle it, and they're learning as we are day by day.
Right.
All the way up the chain and all the way down the chain. So
right. Well, and like we've heard a lot as nurses. We're like, they. If we complain about things, and usually if we're complaining about something, we're complaining because we don't have proper staffing, we don't have proper equipment, like normal things like that you should have to do your job. They're like, well, you signed up for this.
Oh, geez.
No, I did not sign up for a freaking pandemic.
Yeah, no.
Like, no, I signed up to be able to take care of my patients and actually heal them and be able to be there for the families. And I can't do either.
Wow.
I don't know who this is, but Connor James McCarthy, I'm not really sure who that is, but in lieu of Earth Day, he says, coming up, is there any possible way to recycle contaminated PPE?
That is a very good question. I know that, they're recycling the N95s. So we will be reusing those. Those are the masks. The face shields, I would think that that's a pretty easy plastic to recycle. The gowns are not recyclable. It's some kind of weird material, but I can speak for our hospital. We had a recycling program for the plastics for a very short time, and something happened to the recycling and we don't have it anymore, which is very upsetting because we use a lot of plastic. But that's a good question. I don't know, because it's not like the masks aren't like paper. It's kind of like a fabric, but not a fabric. It's like how money is. You know how that's like a
right.
linen or something.
It's like Tyvek. There's a Tyvek material. It's like a hard ripstop in it or something like that.
Yeah. So I don't know, but some of it, like the face shields, I think should be able to.
Now I have a question to feed off of Connor's. Sorry, Chris, real quick. To feed off of Connor's question, is surgical gloves considered a biohazard after wearing them at this point right now? So when people are buying gloves at the store or wearing gloves into a supermarket or a face mask and stuff, is that considered biohazard?
No,
it's not, because it could be contaminated.
It could be contaminated, but I think for things to be considered a biohazard, it has to be saturated in like a body fluid, like blood or some sort, whatever's oozing out of you.
I'm asking because when you put those gloves on, your hands sweat profusely, and then
Oh yeah.
So when you turn inside out, and people are discarding these gloves. And I've seen it more times at supermarkets inside of pushing shopping carts. They just throw them on the ground and whatever. And they should not be doing that at all. I mean, just like any
Well,
litter,
no,
any
that's
litter. for that
disgusting.
matter. But,
Right.
but that's why I asked. It's not considered a biohazard, though.
No.
Okay.
Well, there you go. I'm not even sure how long. I think we're almost at an hour and a half now. But Celena, I want to thank you so much, not just for coming on the podcast, but obviously for what you guys are doing. Please tell your
Thank you.
your compatriots in the ICU and anyone that we also pass on our
Celena, I hope
appreciation.
to see you on this again and not in the ICU, honey.
I certainly hope to never see you in the ICU.
Yeah, that's for sure. Well, anyway,
Unless you guys, if you want to drop off lunch or something, that's cool.
Oh, nice.
Is that welcome? Can we do that?
Oh yeah, people can donate.
Look at that.
Yeah, all the time.
I think there's been a lot of
Actually,
restaurants.
I have to say, we've been eating very well lately.
Nice.
It's bad. Yeah.
Big round
Yeah,
of
the
applause
public-
to the
the
nurses,
public
the
has been
doctors,
amazing.
frontliners.
Thank
Yeah,
you.
thank you so much. So is there a telephone number that people, if they wanted to, like restaurants that wanted to make donations, who would they contact at Salem Hospital?
They could. I don't even know. I think that they could call the marketing department, because I know that some places do donate and marketing will send it to different units.
Okay.
So that you can kind of spread the wealth, because every unit's being affected by COVID. I mean, we're all working like crazy lunatics.
What hospital chain is Salem affiliated with?
Partners.
Partners Health. Okay.
Although they're called Mass Brigham Health now. They've spent $100 million to change their name.
Have any of your coworkers been affected? Have they gotten the COVID at all? Any of you?
A couple of them have, yeah.
Okay.
But so are very mild cases. Nothing, more severe than just some body aches.
So the cases that you see, for them to get in there, they have to be pretty bad. So there may be quite a few cases of people that have them. You're not going to see them until they get to intensive care.
Right.
So the cases that you see are going to be the worst of the worst.
Yes.
By definition of your job.
Exactly.
I wonder what the percentage of, there's so many different things. It's like what the percentage of people that get it that are so mild that, they stay at home. Do you have any information like that? Like what the percentage of people that have been tested get it but are able to stay home instead of being admitted?
I don't. I know that, like I think I had said earlier, we have 110 patients that have COVID. 37 are waiting for results, but only 20 are considered ICU level of care.
Okay. And that's
But I mean, we get a fair amount of patients from that inpatient group. We get a lot of them that are, they're holding steady for a while and then just
boom. And then there's also the ones that you ship off to Boston.
Yes.
So
yeah, usually those go directly from the emergency room before being admitted. They go straight to Boston.
Yeah.
Like if they know they're going to need ICU straight away, they go straight to Boston.
Pat Ciaramitaro wants to thank you. God bless you for all that you do, Celena. And Sharon Jenkins, thanks for coming in and watching. Kim Ellis Cerulo, is that how you say that? To say thank you, Celena, for all that you do. Love you with a heart. And hi, Graciela Ferrara. So
there you go. All right. Thanks. Anybody? Do you have anything to say in closing, Celena?
No, I'm good. I think I talked enough.
You did a great job. I really appreciate it. All right. For Chris McCarthy, Scottie Mack, and Celena, this is Joey Ciaramitaro. Gloucestercast 402 is in the books.